Today I'll be talking on the stool wet mount preparation by saline or iodine. The main objective of this wet mount preparation for the stool by saline or iodine is to assess worm burden of patient, then to provide quick diagnosis of heavily infected specimen, then to check the organism mortality, primary protozoa, trophozoites, zoetis, then to diagnose organism that might not be seen from permanent stain methods. Also a very brief introduction. This tool is the most common specimen which is bring to the diagnostic laboratory. The most commonly performed procedure in parasitology is the ova and parasite, or that is ONP examination. This gastrointestinal infection by parasite pathogen or helminthics are primarily diagnosed by detecting the live motile trophozoites for protozoa, cyst for inactive dormant stage of protozoa, or egg in case of helminthics in stool. So let us see the principle of this wet mount preparation for stool. So stool wet mount preparation, it is the basic method of analyzing a stool specimen in coprology. It utilizes the saline solution as an isotonic media to maintain the cellular structure of the various pathogens that are found in stool. So wet mount for stool is used for the detection of trophozoites and cysts of protozoa and eggs and larvae of helminthids. So for the saline wet mount, it is usually made by mixing a small quantity of feces in a drop of saline placed on a clean glass slide or an iodine. So the smear is then mixed under the microscope, where the saline wet mount is used for the detection of trophozoites and cysts of protozoa and eggs and larvae of helminthics. It is particularly useful for the detection of live motile trophozoites of Entamoeba histolytica, Giardia lamblia, and Balantidium coli. Let us see what are the reagents and the equipments we required. So we need a normal saline, Lugol's iodine, then the glass slides, the cover slip, pipettes, microscopes, and the specimen. So the first one, the procedure for the saline and the iodine is same, just that in case you just have in one slide you can just divide into two portions, where in one side you can add the iodine, where in one side you can add the saline, or else you can just take two slides. It depends on you. So because the procedure is almost same, the only difference is one you have to add saline, one you have to add iodine. Because for the saline preparation, we look for the egg, protozoa, trophozoite mortality, whereas for the iodine we look for the cyst morphological in detail. So the procedure is firstly you have to apply the patient sample to a small area on a clean microscope slide, then remove any gross fibers and particles in the feces. Then immediately before the specimen dries, you have to add 1 to 2 drops of saline or iodine with a pipette, then mix with pipette tip. So for different stool you have to change the pipette tip, keep in mind. Then cover the specimen with a cover slip, then avoid air bubbling. Then also, if desired, the cover slip can be sealed using a petroleum jelly and paraffin oil or any other suitable sealing preparation. Sealing the cover slip keeps the organism from moving when using oil immersion objective, and it also prevents the preparation from drying out. So that is the procedure for the saline and the iodine. It's a very simple technique where you just have to take the specimen, that is the stool, and add 1 or 2 drops of the saline or an iodine, then mix it, then cover it with a cover slip. So for the examination, here I've also given in the image in the picture. So for the examination, you please focus on the figure 4. So for the examination, you have to examine the specimen with a low power objective, that is 10x, and low light. Then begin at one corner. Please focus on the figure 4. Then you have to begin at one corner of the smear and systematically examine successive adjacent swot with the low power microscope. Then low power examination includes the entire area of 22 by 22 cover slip preparation in both saline and iodine. So when a parasite-like object comes into view, it should be more closely examined and identified at under high power, that is 40x objective. Firstly on 10x, then if you see a parasite-like object coming into view, then switch on to the 40x objective. So high dry power examination should include at least 1/3 of the cover slip area, that also both in saline and iodine. Now for the result or the interpretation, a result from the direct smear examination should often be considered as presumptive. However, some organism could be definitely identified, for example like Giardia limbia and Entamoeba histolytica. I have given the image here. Just see the cyst of the Entamoeba histolytica, then the Giardia, because these are the specimen other smear, it can be considered as presumptive, but this organism can be definitely identified at one go. That's why I have given the image of these two only, but you can always refer to your textbook also. Then this report should be okay, before that okay, so this report should be considered preliminary, while the final report could be available only after the result of the concentration and permanent stain smear were available. So there are some limitation of this wet mount preparation for stool. Once iodine is added to the preparation, the organism will be killed and the motility will be lost. So that is when the iodine is added. So that is why in the iodine preparation we usually use for the cell morphological, whereas in saline we look for the motility. So oil immersion examination is not recommended, as so if you use oil immersion, the organism morphology might not be that clear. So this is all about the wet mount preparation of stool for saline and iodine.